This is Dr. Scott Smith, and I am here today to talk about a comparison of tools that can be utilized by judges, attorneys, the general public related to evaluation of DUI screenings. Essentially, the purpose is to evaluate potential screening tools that may assist various judicial officers to understand the potential mental health features of defendants that are under adjudication or being processed in the court system. Primarily, the main system that is used is called the CAR system. It stands for the Computerized Assessment and Referral System. It's widely used in DUI screening within Louisiana and across the United States. This is the primary tool used. It evaluates a combination of risk factors, substance use history, and criminal foundations. It's also provides treatment or intervention recommendations. And I'll talk about this instrument, but likewise what I'll talk about is other instruments. Other instruments are shorter, some are longer, some of them offer more specific detail. There's variation in prices. But what I'm intended to do today is to offer this foundation of knowledge regarding DUI screenings. First, I'll talk about the CARs and then talk about the additional instruments. And again, the CAR system is most often used regarding form. What I'll do is talk about the CARs in relation to form, length, cost, ease of use, also function. And again, what I'm going to do is use the CAR system as a foundation. And then what I'll do is compare the other screening tools against the CAR system. Okay? The first category I'll talk about is simple self-report or interview-based tools. With these, minimal training is required. Now, this will be important because you have to consider who will actually complete the screenings. Now, while we're talking about the word screenings, there's a difference between screenings and assessment. Particularly related to personnel. Screenings can be completed by literally anybody, clerical, professional if you want, non-professionals, even individuals themselves may complete screenings. However, of course, you have to set up the screenings wherein there's a reliable methodology, and also you have to have somebody that understands how to interpret the screenings themselves. But with first set of screenings, these are simple self-report or interview-based tools with minimal training. The TAPS is one of the most often used forms. It's self-administered. It stands for tobacco, alcohol, prescription medicine, and other substance use. That's why it's called TAPS. Okay, it's self-administered. It's a brief assessment. Takes around 10-15 minutes to complete. It's free and available online. You can set up a database to record the results. The information is transferred to a hard drive as opposed to available online, in which there may be HIPAA components. The function is it screens for general use, not really for DUI cases. While the CARS does focus on DUI cases, the TAPS is more of a general screening tool that can be used for employment, within employment settings, school settings, and it's less comprehensive, where it does not really look at criminal behavior and mental health and treatment needs, but rather just looks at simple drug and alcohol use. It is much simpler than the CAR system, but it lacks in-depth DUI-specific behaviors, and it's used as a pre-screening tool before a full DUI risk assessment like CARS. I mean, something that would be possible is to administer the TAPS, and then if positive behaviors were administered to the TAPS, then later utilize the CARS. Okay. There's also another assessment, what's called the CRAFT. It stands the car, relax, alone, forget, friends, trouble. The name is sort of tricky. The main difference is that this is used primarily for kids. It's primarily used for adolescents. The age foundation is around 12 to 21. Obviously people start driving around 15 to 16, and you do have a lot of individuals that obviously are greater than 21 that will attain the DUIs, and in fact the majority of the population of DUI offenders will be older than 21. So this will have potential use, but only with a limited number of people due to the age restrictions. It's free and widely used in healthcare settings. Besides employment, it's often used in public health care, particularly if there's a nurse or somebody that wants to do a screening for drug alcohol use. It focuses primarily on adolescent risk behaviors, and if you do have a large number of individuals that wind up being youth that are DUI offenders, this could be a very good assessment instrument. However, it does not have a lot of applications for individuals older than adolescent. Again, it's not applicable for adult DUI screenings. I would not recommend for it to be a replacement for cars. It could be used as a preliminary screening, but not as a replacement. Probably one of the top 3-4 assessments used is what's called the DAST-10, DAST-10. This is often frequently referenced in the literature, and often if you go to court systems outside of Louisiana, this is one of the most frequently used assessment instruments. It's a simple yes format. It's like some sections of the cars are almost similar. It can be self-reported or administered by a professional. It's quick, low cost. It ranges from about $10 to about $20 in administration. It's a little bit more expensive. It does identify general drug use, but it does not look at DUI risk. And also a limitation is that it does not really address legal mental health, behavioral risk component of cars. It offers, lack of better expression, a light assessment tool, and it may be used as a pre-screening for cars if you're particularly worried about timing. This only takes a little bit of time, about 5-7 minutes. Where cars takes about 10-12 minutes. It's more limited in scope. It really focuses only on drug severity, whereas cars looks at likewise DUI risk and recidivism. It may be used otherwise with as a screening device prior to cars. I really don't recommend it be used as a solid instrument. Perhaps you can use it as a screening to dictate if cars is needed. However, as a standalone instrument, I would not recommend the DAST. And then you have what's called the alcohol, smoking, and substance involvement screening test, which is called the ASSIST. In my opinion, you probably have the cars that is most frequent. You have the DAST, which is second, and then you have the ASSIST, which is probably the third most frequently used screening test. Now, as opposed to the former assessments, you typically do need some type of professional that has some type of mental health training, at least at a bachelor's level, to administer this. It does take about 5 to 10 minutes. Cars, again, takes about 12 to 15. It's significantly shorter. It's free. It's available online. It has what I would call good face validity. It's easy to administer. It's easy to understand. The printouts are relatively good. And talking about good features, it does cover all psychoactive substances, including both alcohol and illicit drugs. But in comparison to cars, it does not address the potential DUI-specific risk, legal history, behavioral patterns. It's a good test. It's a good screening. It's broader but less targeted. It does not look at legal factors or risk classifications. If I had to offer a recommendation, I would recommend cars first, um, DAS second, and then the assist third. However, that's simply a personal recommendation. Oftentimes, I've seen it be paired with CARS for our complete evaluation. In other words, if you complete the CARS system and you find some behaviors represent a concern to you, then what can happen is you can also administer the assist. Both together will take about 15 to 20 minutes. Now, what I'm going to transition to is to tests that do require some type of basic training. The others can be administered by just general individuals. No specific training is required, either in mental health or personnel. However, these require some type of specialized training and understanding. Now, something that's important to recognize is that the specialized training is involved more in the interpretation than really the administration. A lot of these assessments are readily available online. You can administer them and you can get these results. However, the specialized training comes in regarding interpretation of the results. So be careful related to simply saying, hey, I can print these offline, I can administer them. The challenge comes not from administration, but rather the interpretation. And it's from the interpretation is where you need some type of experienced person to determine those. I'm going to examine several of these. The first is what's called the MMSE, or what's called the mini mental status examination. The cost is not that bad. It's around 50 cents per form. It's about $120 for 50, which just translates to about 50 cents per administration. It takes about 5 to 10 minutes to complete. Now, as opposed to strictly DUI, it focuses more on cognitive impairment. It's primarily used in head injury cases, stroke, situations like that. It does not really focus on DUI per se, but rather general mental impairment. And then likewise, you start dealing with general mental impairment, and you start having people, defend themselves in court. You're looking towards a combination of ethical and also logistical things that must be considered. I don't consider it really a substitute for CARS. I'm presenting it as an alternative to just general understanding. It serves more as a function for cognitive impairment versus DUI risk, and it may be used as a supplement as opposed to a standalone instrument. You also have what's called the MINI. It's called the MINI International Neuropsychic Interview. This is a very structured interview. Personally, I've never seen this utilized in the DUI courts. I've seen it used in a lot of forensic settings. I've seen it used in head injury rehabilitation. I've seen it used in stroke. Potentially, it could be used in DUI settings. Reason it's not used in DUI settings is the length of time it takes to complete. This tends to take about 15, 18, 20 minutes. And if you have somebody that's particularly impaired, it's going to take 20, 25 minutes. I've seen it take as long as that. And as opposed to DUI-specific risk behaviors, it focuses primarily on common mental health disorders. It does provide some clarity on what's called comorbid or co-occurring mental health disorders, which likewise have been shown in the literature and just demonstration that these influence DUI recidivism. Again, I would recommend this as a complement, not a replacement for CARS, and I do not recommend it as a direct alternative to a DUI-specific assessment. Its clinical purpose is just more generalized as opposed to simply DUI. The third category I'll talk about is advanced diagnostic tools. I would say in this situation, you either need bachelor's degree individuals with specific mental health training, or you need master's level people that have an advanced knowledge of mental health training. You can look towards individuals with backgrounds in rehabilitation, professional counseling, social work. Applicable education would be a certified rehabilitation counselor, licensed rehabilitation counselor, licensed clinical social work, licensed professional counselor, perhaps even a master's level psychologist that is licensed as a school psychologist. It could be a master's level person with a degree in psychology that has supervision of a PhD, licensed psychologist. But these generally require some advanced diagnostic training, and not only for administration, but also for interpretation. One of the very good tests that I see is what's called the DUI-RANT. It's a web-based. It's web-based, highly structured. If you look at both the cards and also this assessment, they look very similar. It takes a few more minutes than the CARS program. CARS can be completed in about 10 to 12, 13 minutes. This tends to take 15 to 20 minutes, perhaps even 30. Its cost is about $1,300 per year. I would say it's the most comparable or the most similarly matched to the CARS program. It has a good functional match. However, it is at a higher cost. Something I do like is that it does offer automated risk classifications, and it serves as a very good diagnostic tool, particularly if you're in situations wherein you want information to substantiate treatment. Are you trying to get information for pretrial diversion, and you're trying to use it for the direct treatment? I think it's a very good assessment tool. It does take a little bit longer. I do have doubts whether or not it could be used directly prior to court, but more like in a pretrial diversion or a pretrial evaluation, it'd be a whole lot better. You do have what's called the GHQ-60, which stands for the General Health Questionnaire. This is used a lot in clinical and research settings. I've seen it used in settings. However, something that's difficult that I've always had difficult to determine is the cost. Typically, when you go to a clinic, it's a clinic-based subscription. I personally don't have a subscription. I've administered when I've worked within clinics, but the website and you contact individuals, they don't really give specific information related to the cost. So it's hard for me to identify what the potential cost will be. I overall would not recommend it for a substitute for DUI screenings. It may be supplemented. It's more of a component where somebody has multiple DUI-related behaviors and you're looking towards mental health concerns as comorbid factors. The next one we'll talk about is the CIDI, or the CIDI, which stands for the Composite International Diagnostic Interview. This is a long assessment. It's a very good assessment, but it's a long assessment. It takes anywhere from 45 minutes to 2 hours. I've never seen this administer less than about an hour and a half. It does require, in my opinion, a licensed person to administer due to the need to control behaviors for individuals that are being tested in order to redirect behaviors. As oftentimes with assessments this long, clients, referrals, defendants will tend to get very frustrated. You need to redirect, and you need to have somebody with expertise in diagnostics to administer this test. It does not look towards DUI-specific behaviors, but rather comorbid conditions. It's far more complex. I don't consider it practical, but I'm including it for educational purposes. It could be used alongside cars. If you have individuals that are second, third DUI individuals, and you're trying to look towards treatment recommendations and protocols, I think that the CIDI or CIDI is an appropriate instrument. However, you're looking towards an investment of at least 3 hours per administration, and perhaps 4 hours with interpretation. So it's a good instrument. It takes a long time. The longer time it takes to administer, you get some very good information. If you have somebody that's a repeat offender, I think this could be good to be utilized alongside cars, but you have to recognize both the time investment in this, okay? Now, we've talked about it a lot. However, what I want to do is go ahead and talk about how these assessment compares to cars. Essentially, the closest comparison to cars, in my opinion, is the DUI-RANT. The key difference is it's more expensive, it's web-based, but similar in function. Now, something you have to be careful with web-based assessments is the integrity of the confidentiality. Likewise, in this situation, you need to use some type of code to make sure that the information is confidential, where you can't identify who the person is. The TAPs and the assist are also have close comparisons. The DAS-10, MMSE, CIDI, they have quality purposes in screening. However, they're not the same form and function of the CAR system. It could be possible to utilize the DAS, MMSE, and CIDI as a supplement or in addition to the CAR system, but these are primarily used for either looking at drug severity with the DAS-10, cognitive function with MMSE, or with the CIDI, lengthy psychiatric evaluations. These are more used towards psychological, psychiatric consultations as opposed to simply DUI screenings. However, if you had the personnel, and likewise you had the personnel trained to administer and also interpret those, you may utilize these last three alongside the CARs in order to obtain a fuller understanding of your client or of the defendant. However, you're going to have specialized training, and in certain circumstances that may be very valuable, but you have to evaluate the time and also the expense